Hi, I'm Laura Siminoff, Dean of the College of Public Health at Temple University. And joining me are faculty experts Graciela Jaschek, Sarah Bass, and Heather Murphy. And today we're going to be discussing a little bit about pediatric vaccination, but we're also going to be focusing on how things have changed in our understanding of the virus and what those implications are for the future. So first, let's just touch on pediatric vaccination, and I'm going to turn to Sarah for that.
Sure. So pediatric vaccinations have been approved with emergency authorization by FDA for kids who are between the ages of 5 and 11. It's a lower dose than what's given to adults, and the shots are given in a 21 day, in between 21 days, and it's Pfizer. Those are now being offered all over the country for kids. Some of the concerns that parents have had, I think one of the main ones that seems to be going around is a risk of myocarditis or pericarditis of the heart. And the interesting thing is that the data that came out of the trial that they put to the FDA showed actually no cases of that occurring in that age group in the children who are in that in the trial. If we look at what's the risk of that for all vaccinations for COVID, it's about 1 in 100,000. So it's a very low risk. The chances of dying in a car crash are actually 1 in 106 or so. So I think we have to kind of think about that in perspective. But it is going to be important for children to be vaccinated, especially if we want to get back into school situations where everything is open.
Right. So any other thoughts about pediatric vaccination? I know there are lots of parents that are really gung-ho to get their kids vaccinated, and other people are like, well, but my child has so little chance of dying from COVID, so why bother?
I think that some parents it's a personal sense of risk. And some parents who either have children who are, they have asthma or they have some respiratory disease or prone to upper respiratory diseases feel very nervous of sending their children to schools without the extra protection from vaccines. And I think those are the parents who pretty much are saying, sign me up, and then they don't even hesitate. And then there are other parents, there is vaccine hesitancy, and then we cannot change the sense of risk these parents have. And they weigh in, essentially, they are at very low risk of severe disease and hospitalization and death. And then why should I vaccinate my children? They don't transmit the disease as much, but it's not about thinking about yourself and your own family. It's thinking about, well, you are sending your child and then you are putting other children in danger. So I think it's really interesting. That debate between yes, no, vaccinate, not vaccinate is very interesting.
I think you get a lot of the wait and see too with parents. The trial with kids was fairly small. So I think there was only about 3,000 kids in the original trial. But since it's been approved, I think in this last week, we had 1 million kids get vaccinated in the US. So it was a pretty large number, right away. And hopefully that will help some parents who are on the fence kind of go into the vaccination side.
I also think that, adults have been vaccinated. We've been vaccinated for almost a year now. And that shows that it's not a risk for adults. So in a sense, why should it be a risk for children if we do the analogy? But again, personal risk, ideas of personal risk come into play.
Yeah.
Well, we don't know the long-term impacts of COVID on kids either. Just like we don't really know what it is. Like, they might be asymptomatic and have a really mild reaction, but you don't know if there's kind of longer term effects that we're seeing in other populations. And one way I want to look at it, because I have 2 kids, and I also saw the data with only 3,000 kids, and I took a minute, like, well, that's not a very big study, but then I want to look up all of the vaccines that I'm happily get my kids vaccinated for, and look at what are the side effects and what are the risks. And I think if we put it in that perspective, I don't think the COVID vaccine is going to be any more risky than the flu shot or any adverse side effects you'd see in any standard childhood vaccinations.
Mhm. Yeah, so I guess the take home is that, obviously you need to think about the personal risk that you think your child has, your family, and what it would mean to your family if your child's get COVID. Because remember, when children do get COVID, even if it's not that serious, now they have to stay home, they have to isolate. That can be really hard and tough for working parents. So I think there's a lot of different factors that should be weighed while you're thinking about it. But COVID vaccine is a safe and effective vaccine. Millions and millions and millions of people have taken it all over the world. They probably have done some of the biggest trials with COVID and following people has ever been done for any vaccine. So if you're personally comfortable and have been comfortable taking vaccines all these years, there's no reason why you would see the COVID vaccine is any different. So, but the COVID virus is a different issue. SARS-CoV-2 is a very, very new virus for all of us. We all inhabit bodies that have never been exposed to this virus before. And I think that's had a lot of implications for what's happened over the last 1 year and about 9 months. And I think for the future as well. So we're going to spend the rest of our time talking about that. We're going to talk about, think backwards to the beginning of the pandemic and what people were told, and then what we've currently learned, and then what we think the future has to hold. So who would like to go first? Maybe let's talk about what we knew, things that we got wrong, and then what we really, really know now.
I can start with, I have a story from a student who sent me an email. She needed a letter of recommendation, and she was in my class in 2020, spring of 2020. And she told me, I remember when you walked into the classroom at the very beginning, like it was in January or February, and we started hearing about SARS-CoV-2, COVID-19. And she remembers me saying, this is really serious. We have to pay attention. This is going to become huge. I don't even remember that. And then it really brought me back to the fact that at the beginning, we really didn't know much. And this is what science is about. It's about discovery as we go along. And if everybody puts in their thinking, their research, then that's the way we are going to develop our knowledge. So sometimes it may seem contradictory, but it's not. It's just what we know at the time. And we make decisions based on that knowledge. And I think that we have to remember that we are a way, we know so much more than we knew almost 2 years ago. And there are so many things that treatments now, vaccine, the best way to prevent COVID-19. So I think that we have to keep in mind science is evolving and will continue evolving because we still don't know much about many things about SARS-CoV-2.
Yeah, I mean, I think the problem is that it never got messaged that way from the very beginning. So, if we had started the messaging in the beginning with, we don't know a lot, this is what we think, this is what we think everybody should do to protect themselves. And as we know more, we'll let you know how that changes. Instead, it was very kind of black and white. You have to do this, you have to do that. And then what the public sees is that is somehow us lying or somehow us, not knowing what we're talking about. And that's plagued messaging around COVID since the very beginning, from day one.
Yeah, I would agree, Sarah. Just kind of it seemed like the messaging was flip-flopping and that basically scientists didn't know, and the public was like, well, they don't really know what they're talking about. So it was hard to believe. And we started off, I remember doing this video on hand washing, and that's what we were promoting. And that's great for infectious disease control in general. So it's a great practice. But then we evolved onto, like, I remember people were disinfecting their groceries when they're coming home. We didn't know how long it would survive on surfaces. And like everyone is still like washing everything down. And that, I think, is some of the messaging that has stuck. And now we really know it's airborne. Like predominant transmission is through the air. And so our masks that at first nobody wore, and at that time that was what we thought was the best recommendation. And at the time we needed to save the masks for healthcare workers, and we didn't want them to be hoarding them, or people, the general public, to be hoarding medical masks. So I think what Sarah's saying basically about the messaging was all wrong. Like the decisions weren't wrong. It's just the way it was communicated to the public could have been done so much better. And maybe there won't be, hopefully there won't be a new pandemic anytime soon, but maybe we've learned something on messaging in terms of like if there's another pandemic with another virus.
I hope so. And I agree with all of you. It's just been, for the public, kind of a roller coaster. And at a point, people tune out. But we also know that cognitively, the first things you learn about something are what impress. And you can start trying to correct, but it's very, very difficult to do that. And I think that's kind of where we've landed. So let me ask each of you, if there was one thing you would want the public to know, what would it be?
Just in general about COVID?
Just in general, yeah.
It's preventable. Right? You know, we have the greatest thing about the science is that we've had, you know, so many people involved, and we do, as Graciela said, know so much in such a short period of time. You know, we may not know all of the kind of mechanisms, all the small kinds of details, but in general, those broad strokes, we know that masks work, and we know that social distancing works, and we know that vaccines work. And those are all in our control.
I would say that how important the interconnectedness is, that this is a disease that doesn't just happen in one country, it happens to everybody in the world, and how important that interconnectedness, the coming together to find a solution is, and how powerful it is.
Are there anything to add?
I guess I want to reiterate like that vaccines work, and it's pretty amazing all the scientists around the world that got together to really make this happen. We've never in the history, I think, of public health rapidly made a vaccine so quickly that is highly effective, like really so remarkable. And I think like people should trust the vaccine and trust the science behind it. And we've never succeeded at doing this ever in the history of man. So
just think about where we would be if we didn't have the vaccine. Right.
It would be dire. It would be really bad.
Well, very early on, they were predicting over 2 million deaths without the vaccine. So in the United States alone. So I think we are doing much better than that.
Yeah, although we would have done better still if people would have taken the vaccine, more people would have taken the vaccine faster and wear masks. So where do you think we're going? Like, what people always say, so when does this end? Some people like to think it's done, but it really isn't. So when do people think this will end, and what is the future?
Well, I think that we are hoping with the vaccines, this is going to end, but more than likely the virus is going to remain endemic. And endemic means that it's circulating in the population, and it's going to remain circulating in the population because there will be pools of unvaccinated people, either because of vaccine hesitancy or because lack of access to vaccines like in other poor countries. I think that there will be waning immunity. I mean, right now we know that we have waning immunity, We also think that the virus, the more it gets transmitted, the more chances for it to mutate, and that's a high possibility. But also there are animal reservoirs. So deer, cats, big cats, dogs, minks, they carry SARS-CoV-2, and that may re-enter into the human population. So I think it's going to remain circulating in the population with spikes, although we don't understand if it's going to be seasonal spikes, because we had a spike in the summer and a spike in the winter in this country. But more than likely, it will remain out there, and we will need boosters in the future, just like with the flu.
Right. So should we all continue wearing our masks indefinitely?
That's a hard
Heather,
one, right?
Heather, what do you think?
I'm going to wear my mask on airplanes, in grocery stores, I think for a very long time, and in certain social settings. I have never been healthier, to be honest, like not getting sick, which I really like. But like Graciela said, I think it's going to be endemic, and it is going to transmit like influenza viruses, and they move through animal populations, human populations, and it's going to be a virus to watch for, and there's going to be different variants of concern, and we're probably going to have an annual coronavirus shot, just like a flu shot, to keep it at bay. Yeah. So I don't think it's ever going away. Things will become more normal, I think, like previously, but I don't think it's going away.
And I think that, you know, as it wanes, our sense of risk wanes as well, right? So especially if we have to have vaccinations every year, booster shots every year, let's say, like we do with the flu, you know, the flu vaccination uptake is very low in the US. And I fear that that's where we're going to get to. And I think the news that's coming out of the new oral treatment for people who have, you know, newly gotten COVID is going to just feed into that. It's going to be like, well, I don't really have to get the vaccine because they have this medication that I can take and I'm not going to get really sick anyway. And so those, I think, all kind of play into this feeling of risk perception, and that feeling that, you know, it's not going to happen to me. And we all are getting kind of back to that, where we, you know, had a pretty heightened sense of risk for most people for about a year.
So it sounds like the virus will become endemic, which means that it will just be living amongst us, probably permanently. There's always a possibility for mutation. And we're probably going to need to wear our masks, at least in crowded public situations, for a long time, although some people will, and some people who feel more at risk will do that, and others who feel that, you know, if I get it, it's no big deal, probably will not. So I think that's probably where we are at this point. Hopefully we will not have huge surges again in the winter, but I guess that remains to be seen. So I would urge everybody to continue to be vigilant, to continue to wear their masks, to get their vaccination if they haven't done so, to seriously consider a booster, and also to think about, if you have children, whether they be 18 and under or now 5 to 11, to really get the vaccine. So thank you all. Thanks to the faculty. And to view this and other videos, go to cph.temple.edu/coronavirus. Thanks.